So as we go through, we've been carried a few questions sent into us, so as we go. But first off, this is a question for the students. Fantastic talk. You've spoken about community building. How do you measure whether your inclusion initiatives are working, and what data or feedback matters most?
Hello. Yeah, there's up here. Yeah, and I think this was something that I talked about before, which is I'm not sure how you actually measure it in a quantitative way, but I think you should be able to identify who is continuing to show up to your event, who is giving you feedback, whose feedback you are listening to. I think maybe I'll give you just like an anecdotal evidence here. So when Marcus and I were, after postgrad school, and we were working together to build this organization called the Minority Graduate Student Network. And what it really aimed to be was an a cross-institutional organization that really brought together minority graduate students across different academic institutions. Why did we want to do that? Well, because if you are at your own individual institution, okay, maybe you knew a few of the Black and brown folks there and the white folks there, maybe you had your own little hub there. Well, what about connecting all the different communities throughout New York, throughout the different academic institutions, right? Like, if I felt a particular way being at the Albert Einstein College of Medicine, maybe there was someone at NYU that felt that same way, that also felt the same way at Columbia. Now, again, it was both about building community, but it was also about collaboration. It was, well, if I want to share a scientific idea, if I need to have access to a different core facility, who were the people, that felt like were my people that I could talk to and work through. I raise that because building that was really tricky. It was tricky to kind of bring a bunch of people from a bunch of different institutions around the same table to, first of all, even agree on what that community should look like, who the community should serve, and kind of by which mechanisms we should do that. I don't know that we actually ended up ever getting there. I think we had a number of different iterations. I think we had a lot of events. I think a lot of people were showing up. I think we were coming back to the table and saying what's working and what isn't. And so I think maybe to succinctly answer the question, and I don't know that there's necessarily data that I could have collected or we could have collected other than, are enough people showing up, are the same kind of people showing up. But then also what I would say is how can we actually also not just hoard all of the information and the power of ourselves, like at those particular institutions, and kind of share that back to other folks so that they can kind of continue building that community even without us. I think that is maybe also actually a way you could understand if your community is actually sustainable and thriving, because it should be able to exist in the absence of you, because you've been able to kind of give your community the tools and the framework and the network to kind of continue in your absence. So I don't know if that was a succinct enough answer, but hopefully that answered something.
Do you mind? I just wanted to add that in a lot of higher education spaces, they'll do, and in some medical spaces, they'll do climate surveys. So these are these annual surveys, and it's important that it's done sort of regularly because you can get a pulse of the temperature, within your environment. If people feel like they belong, are they included? Not just being included, but are they valued? Are they allowed to kind of, speak up and be a part of things? And so there are these sort of what we call like measured instruments, which are essentially these surveys that have been validated that are used not just within that particular domain, but you can compare across other institutions as well. And so that's valuable to be able to sort of look within your institution and see how you compare nationally to others as well. And that's at the population level. At the individual level, we often in leadership training will do kind of these 360 evaluations where, you're kind of blinded, you essentially, there's a survey that's given out to all of those people that either sort of report to you or you report to them, and they provide anonymous feedback. And sometimes those things sting, so it has to be done in a very facilitated way, but it's a way sometimes to get a sense of how people feel within a particular environment. And then finally, you also have qualitative interviewing and focus groups and so forth. But those things are always best done when it's like facilitated, and it's not just you or there's not bias or you don't want feel as if people have to say, oh yeah, and things are good, because they feel like they might be retaliated against, for that.
This is a question to any or the speakers. If you're hiring for a position where 1 in 50 applicants is a woman, i.e. had a medicinal chemistry, how do we approach that? You can see defeat on that position if that person isn't a fit. Over-index, extra emphasize diversity in other positions. How would you go about handling a situation like that?
All right, so hiring can be tricky, as you may know, because in clinical research, we do not retain a lot of our employees. And it's not because we have bad companies. It's a lot of times, these companies sometimes don't give exactly what individuals want to stay. So right now, what is big is work-life balance. When I started, there was no such thing as work-life balance, right? So for me, when it comes down to picking individuals for their clinical, I just want to make sure they actually align with our culture. And when I say our culture, that means like they understand work-life balance, they understand our expectations, and things of that nature as well. People do look good on paper when we start asking them in-depth questions about certain particular positions that they should know. The one-on-one questions, like you should know this for entry level, it's easier to eliminate individuals. So we are really, really big on diverse individuals being a part of Sierra Clinical. However, we do still pick the best fit no matter what.
And I would just kind of add on to that something that I was saying earlier about okay, if I were to be assessing 50 companies and only one of those companies had a female founder or, was a female-led team, I would just be wondering, did we actually cast a wide enough net? Because again, good ideas, good candidates can come from anywhere, but you can only have as diverse of an applicant hire as your pool is. But to your point, once you start asking those questions, people can eliminate themselves, but again, just making sure that at the very least. So I don't know if there was 50 people, I feel like in this economy, job offers get way more than 50, so I would just try to cast a wider net if I really wasn't finding the candidate that I wanted.
So again, to all the speakers, as a person of colour, I have to question myself in rooms that feel that you don't look like me. How have you overcome this in your past experiences?
Even starting in entry level, I started like that. I had to audit all individuals that were non-minorities. And so trying to tell a doctor that they're not doing things right for clinical research and you are young and they've been doing this for 20-something years, it's like, little black girl, if you don't get out of my face, I'm not going to listen to you. So you had to learn ways to still get your point across without feeling like you had to be the aggressor in that particular room. So typically what I would say is, okay, you don't have to do it, but I'm going to just write you up. That's all you really can say at that moment, because I have watched individuals who were minorities as well just get back, try to aggressively tell someone that has way more experience in that particular area why they're doing something wrong or how you found a mistake or error. It's very intimidating, but for clinical research, let's put it that way, you're thrown into the wolves, you have to figure it out because that's what you're called to do. And it's not for everybody. I've watched a lot of individuals say, I'm not going to be a Syrian, I can't do that. I can't, or they have started and just felt as though it was just too rough.
And it's just making you a better person, make you stronger in that particular room. You don't want to be the only person of minority descent in the room, but hey, you can't help it. Either you decide to go to a career that has more minorities, or you decide that, okay, I am meant to be in this room as well, and I can provide the services that's necessary for this particular position set.
I've often found myself in kind of being the only in many spaces, certainly kind of the only African American male or the only person of color, but oftentimes the youngest person in the room too. I remember being at an event, and it was a person of color who came up to me, and they were like, "Oh yeah, what do you do?" And at the time, I was an assistant dean at Walter Medicine, and I think I had maybe just was about a year or two into my position, and they, like the microaggressions, they were like, "Assistant dean of what? Like how old are you?" Like, at the time I was in my 30s. I was like 30 something, And they was like, "You're so young." And I was like, "Yeah, I am." I just had to own it at that point. But it can beat you up after hearing that so over and over and over. And so, I don't know that you ever sort of overcome it. You just kind of be comfortable with it, and you have to stand in your own space, in your own skin, with whatever that makes you different from the rest of the room. But that's also your superpower. That's why people sort of look and lean in and listen to you, because you bring a different perspective. And so it's a mind shift, a frame of mind. But it's also a challenge for those of us who are in sort of positions of power and leverage and privilege to also make space for others and make them feel welcome, invite them to comment when someone is different or new to a space. So 2 points of view on that.
Dr. Sabria, what advice do you have towards starting out in her career in life sciences who doesn't know quite what it fits in?
Yes. I think read the question again. So this person is saying that they don't know where they fit in, but they know that they want to do something in science, perhaps? Yeah, I think that, and I didn't really talk too much about my kind of own personal journey or like how I kind of got to the various roles. I think that one of the things that I really had to allow myself to do actually is allow other people to have more faith in myself than I had in myself at that time. And what I mean by that is, I think I've been very lucky that the number of roles that I've had that I ultimately ended up taking is because someone else told me, "I think this is a good fit for you," because I was telling myself I'm not a good fit for this role. And so I think when you are in that space of self-doubt, kind of open your network, open your, kind of widen your aperture of like who you are asking first and foremost. Because I think that we can be our harshest critics, And when I started telling people like what I was saying about myself to myself, they were just like, "But why are you saying that? You have a degree, you have a point of view, you have a skill set that is needed in these particular spaces." So I think that it is always, at least for me, it's always felt like a little bit of a leap of faith. But the faith wasn't from me inside, it was from other people saying, I not only do I believe in you, but I'm going to be there to help you. Maybe one concrete example I can give is actually right out of grad school, I had the opportunity, and another Black woman who actually helped me here, her name is Dr. Gilda Berabino, at the time was the Dean of Engineering at City College of New York. I was at an event similar to this, she was on stage similar to this, and then afterwards I went up to her and I think I actually said, "I don't know what I think I want to do, but I would love to share with you what I think I'm good at, and maybe we can build a relationship or you can help me or whatever." And so I was in her office, I was telling her the things that I wanted to do, that I was interested in, that I'd learned when I was in grad school, the stuff that I'd been trying to do with the Minority Graduate Student Network. And she said to me, "Oh, well, we just got some funding to help build a new master's program in translational medicine. It's about getting scientists and engineers to understand and think about the world differently as it relates to building tools and technologies. And we're looking for people to build this program." Is that something that would be of interest to you? And I just got my degree. What do I know about building master's programs? What do I know about commercializing technologies? But she told me, I think with the skills that you have, I think you could be a really good person for this. I actually turned the job down at first. And I told her all the reasons why. I was like, because of this and this, and she let me ramble on. And then she said, okay, but when will you be ready? When do you think you'll feel confident enough to take this job? And I think that I gave myself a 3-month timeline. Because again, 3 months I'm going to be more confident in myself. I don't know how that's going to happen. But in any event, she saw something in me that I hadn't yet seen in myself, and she saw the possibility in me. So I think that if you are still kind of trying to figure out where do you fit in, tell people, say, I don't know where I fit in, this is what I'm interested in doing, and I think you should allow yourself to be surprised by what comes back.
Dr. Sade, this actually came up in our last event, and it feels like quite a hard question to answer. Why do you think underrepresented people don't appear in clinical trials? And what steps do you think we can take to increase participation of these groups in clinical trials?
So participants, I do know, as I stated before, we have had some previous historical things that have happened with minorities in clinical trials where consent was not actually provided. That has now still to this day hindered us to actually be willing and open to participate in clinical trials. I think now what we need to do, because there is so much documentation, regulatory, and other protection for participants to participate in clinical trials is much safer. And now we just have to educate individuals in our community. So a lot of individuals in our community don't know about clinical trials, and we actually don't have access to clinical trials a lot of times. And for some reason, a lot of pharmaceutical companies don't really decide to actually partner with individuals or communities of minority descent to also help enrollment. But I think once we start educating individuals, showing how important it is to participate in clinical trials, I think we'll get more of individuals that's open to participate. The only thing is that we hope that it is still a requirement in the future that we have to have individuals of minority descent in clinical trials. That particular enforcement has been placed on hold due to the Trump administration, as you may know. So we hope that pharmaceutical companies don't go back to just being like, oh, we're just going to enroll when we can. And we know that as research shows, you can easily enroll someone of Caucasian descent, but not individuals of minority descent. So I think it's really, really huge. But also, I state to other individuals as well, we tend to want to participate in things where we see us involved in it as well. So we need more Black doctors and PIs to also be the doctors that conduct clinical trials. If we have more doctors conduct clinical trials, not just Black, but minority descent, those particular minority subjects, patients, things of that nature, will be more open to participating in clinical trials. Because believe it or not, minority, let's say minority communities, we really do listen to our doctors. We go by whatever our doctors say. So our doctors involved in that clinical trial, I think it's so much easier to pull us into clinical trials as well.
One other thing that I think is important to mention too is that the ripple effect of not including the population in clinical trials that are most impacted by a particular disease is that one that ultimately gets on the market and it doesn't work in that particular population, there's also a loss of money.
Right.
And it's staying against the pharmaceutical company. I'm completely forgetting the name of the drug and probably misremembering the disease as well. But when I was at the building this master's program, one case study that I used to talk about was this very thing. I think it was like a drug that was for lupus. And if you looked at who was in the clinical trial for it, it was like 2% Black people. When lupus is mostly or predominantly, Black individuals are predominantly impacted by lupus. And so when the drug came on the market, there literally was like in the disclaimer, like this has not, been tested in, a large enough population for African Americans to know the efficacy. So it's like, so what are we doing here? So I think there is larger ripple effects to not having the intended populations or enough of a global population in clinical trials as well.
You're right. I believe that it is a cost thing too. They want to lose money, but for some reason, pharmaceutical companies haven't caught on to that just yet. I don't know why, because trillions of dollars is left on the table when you don't get the individuals that's supposed to have the medicine. It makes no sense. And majority of these pharmaceutical companies, it's all about the money. So it's like, if you're so all about the money, just get the people that's supposed to be in the clinical trials in a clinical trial. The other issue is once those actual medications are approved, you get stuck where your doctor's playing that game of figuring out what drug actually works for you. So if that drug doesn't work today, he's going to give you Tylenol tomorrow. Give you aspirin, Tylenol tomorrow. Tylenol doesn't work, he give you ibuprofen. It is a playing game regardless. So you still become a guinea pig, but you become a guinea pig on something that you don't even know even works for your particular descent. So that's why it's important to have individuals that just speak on the jobs.
Not to plug my own podcast or anything, but if you want to find out more about some of the data that goes into this very subject, one of our speakers in London, Dr. Elsa Zanke, runs a company called Superdata, who specifically look at bringing through the underrepresented groups in clinical trials. And you can find out www.lifesciences.com/. Give you that. Okay, I haven't done that one in a while. Dr. Marcus, could you share a story about a mentorship experience that shaped your journey, and how did you carry that forward?
Thank you. One other piece about the clinical trial is I've also seen faith-based networks like churches be so important in being able to bring a sense of trust, between the community and pharma and, sponsors. And I think we need more of those networks, like faith-based networks that can help inform about clinical trials. So I shared in my talk the story of Joe Oppenheim, and that was a really formative mentor for me at many different career stages, not just learning about the path to research, but also getting into my first faculty position and so forth, really, helping me get connected to my first job. And so now I kind of want to flip the script a little bit. When I was also at Ball Cornell, I used to run a summer research opportunity, summer program. And there was a student there who's originally from Puerto Rico, UPR, University of Puerto Rico, who had come to New York to participate in a summer research opportunity. Turns out his family was impacted by the hurricanes in Puerto Rico. So, much of his family business, was destroyed, devastated, but he persisted, throughout all of these different challenges. When it came time to apply to graduate school and PhD programs, turns out that, I'm reading his application because he applied to our school at the time, and I read a letter that just was not supportive at all. These are supposed to be letters of support. They're supposed to be encouraging. If you're not writing a letter of support, then you should tell the applicant, I'm not comfortable with writing, a letter of recommendation. But this letter was pretty damning, and it came from the experience that he had at my institution, the laboratory that he worked in. And I was the one who had a hand in placing him in that laboratory, but I had no idea that the mentor felt this way about that student. So, I went to the mentor and I said, why did you write this letter? He's not going to get accepted to any program. And, he said, he had trouble showing up in the lab on time, and this and that. Student had no idea, I had no idea until it came time, for that. So I probably did something that maybe I wasn't supposed to do, but I intervened and said, do not get any more letters of recommendation from this mentor. And he, he just was so confused. He's, why? What's going on? And, after not getting accepted to any programs, we would talk more about it. And I said, next year I'll write your letters. Because, applying to PhD programs is so critical that you get that research mentor who can vouch for you and say that this is, they're really passionate about this, they're going to be a great student. So the student had to ultimately apply to these post-bac programs before actually applying to a PhD, because they, just did not have a competitive application at that point. So they applied to a post-bac program, got accepted to a post-bac program. I wrote the letter of recommendation for that, got into another phenomenal lab, and then ultimately got into a PhD program. Turns out, it's a very prestigious Ivy League institution, and recently just finished their PhD. And not only did they finish their PhD, they finished their PhD with flying colors. Was like an HHMI-funded investigating student, had this Gilliam Fellowship, has a fully funded postdoctoral fellowship, just one of the best scientists that you would ever meet. But could have not made it into a graduate program. And, he sort of thanks me. I said, just pay it forward. Just pay it forward. But because of that, he is paying it forward. And it's a ripple effect. So we have to be intentional about the mentorship that we do. And that's what people have done for me. They've gone the extra mile. They've recognized, value when you don't often see it in yourself sometimes. And that really makes a difference.
I think we've got time for 3 more questions. So if your question isn't asked, you just got the guidance afterwards, maybe over a pint. So this is an interesting one. What is your advice for an immigrant scientist who doesn't really have a network? Where in the heck do you even start?
New York can be such a tricky place. But it can also be really wonderful. So when I first came to New York, I was a year out of college. I had a suitcase and a one-way ticket to New York. No friends. I was dating one person. He lived here, so he was like, "Come to New York," and I was like, "Okay." So I came, and I knew him, and maybe one other person. And I just sort of kind of like went out into the city. I was like walking around, and I have a similar Joel story, which is that I just sort of like walked into NYU and it was like, "I'm interested in PhD programs," and he was like, "I will take you on a tour." But in any event, it can be really hard. But what I started to do was finding my people, right? I was starting to tell people that I was in New York. They were saying, "Oh, you need to meet my friend," and that was this kind of like ripple effect of building my network. Now I've been in New York now for 18 years, and I've been very, very fortunate to not just find my people, but like keep them close to me at the various stages of my professional and personal journey. The one thing that I do think is important to say, and it might raise some eyebrows, is that there's a saying, all skin folk ain't kin folk, which means that just because you're in a diverse environment doesn't necessarily mean that it is inclusive. I'm sure there are studies that show that women can sometimes be women's own worst enemies, especially at like the highest levels. So I think you also have to be really careful about who you let into your circle at those early stages, who you allow to get to know you. There have been these conversations I've been having with some folks, even at the early stages of my journey. It's like, "Oh, you should be able to bring your whole self to work." And I'm like, I have no interest in doing that, actually. Because to your point, like sometimes we are in these rooms and, the Sabria that's at the cookout does not necessarily need to be the Sabria that's in the conference room, right? So I think it's being also very mindful of what you are even looking for in a network, whether that's your personal one or your professional one. But I also think you need to start trusting your gut and figuring out, who do I want to open myself up to? Who do I need to just be a little bit more reserved too. But I think the nice thing about New York is that there are so many different kinds of communities, kinds of groups, especially if you're just kind of starting out. I will say there's a saying going around on the internet now, it's like, if you want to be in a village, you have to be a villager. So you have to actually show up to things. You can't just kind of expect people to come to you and kind of assume that, what it is that you need. So there is a little bit of uncomfortableness in the beginning of going to events by yourself, or being able to walk into conversations and just introduce yourself. And maybe the one last thing I'll say, just in terms of paying it forward, is because I was that person, the earliest stages. Oftentimes when I'm at networking places now, it's like, because I've been in New York now, I know a bunch of people, the room's already. But if I can see someone just on the outskirts wanting to not sure if they should say hi, or if they're waiting for a break in the conversation to introduce themselves, I will actually stop talking and open up my shoulder and be like, hi, I noticed you're standing here, what's your name, what brought you here? So I think one, that's, how I have been trying to pay it forward, but also with the understanding that you kind of have to show up to begin with in order to build those networks.
And just a feedback for me in Philadelphia, I didn't meet or had a lot of friends in the pharma or life science sector. So I was able to be exposed through LinkedIn or somewhere, a particular different organizations. So they have Women Alliance for Science, and then they have Diversity Alliance for Science. They have Women of Pharma and Color. They have different things like Black Women in Clinical Research. So you can definitely look for different things, especially for your minority group in that particular area. For me, when I became owner of a company, I had to figure out how can I find people diverse to sit that also owns life science companies. That wasn't particularly in Philly, but it was a national company called Diversity Alliance for Science. That particular company is for individuals that are a minority descent, not just Black, of course, that owns different life science companies. And it became a great opportunity to meet individuals that own life science companies and converse about life science. We have to talk about the trials and tribulations of it, right? So if you're definitely looking for individuals that are like-minded, there are organizations to be a part of. Some of them are expensive and some of them are great pricing. But I would definitely say try those organizations because you will probably meet a lot of